Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Today's show will be a little bit different than our normal show. We are spotlighting our APPs, or Advanced Practice Professionals, here at Novant Health. And so we'll have two guests today who are Advanced Practice Professionals and one physician. Our first guest today will be Certified Nurse Midwife Jessica Bentley. And our second guest will be Advanced Nurse Practitioner Barbara Wickham. But in addition to those, we will have Dr. David Koenig, who is a hospitalist here at Novant Health Brunswick Medical Center and works with APPs frequently, day in, day out. So stay tuned to learn more on HealthWatch. Please welcome our next guest, Jessica Bentley, who's a nurse midwife at Novant Health OBGYN right here in Bolivia. How are you today, Jessica?
I'm good, thank you.
Thanks so much for coming on. I know we had a great conversation just the other day, and I'm so excited that we're doing it on TV now.
Thank you. It was so nice to meet you, and I'm excited to be here.
Thank you. Well, let's start by learning a little bit about you. So tell me, how long have you been here at Novant Health? And tell me a little bit about where you went to school.
Okay. So I have been here at the Bolivia location for almost a year. Next month it'll be a year, but I worked in Charlotte for many years as a labor and delivery nurse.
Oh, at which hospital in Charlotte?
Matthews.
Matthews. That's a really nice little hospital.
It's
like
beautiful.
That. Yeah, yeah. Well, tell me about your education.
So I started as a labor and delivery nurse. Well, originally I was an ICU nurse, and then I transferred up to labor and delivery, and I was a labor and delivery nurse for 18 years, and always knew I wanted to be a bigger voice and a bigger advocate for my patients. So I was in an earthquake in Haiti in 2010, and knew that that was like my push to, okay, yep, you need to go back to school. And I delivered many babies in Haiti, and I knew I wanted to be able to offer more to my patients.
Oh, that's probably another story, and we'll talk about that at some point. Maybe not today, but that Haiti that would be an interesting story. So, most people, I would say probably everyone, has heard of nurses. Some may have heard about nurse midwives. And you're both. So tell me what that means. What exactly is a midwife, and how do you get there?
So what's nice about being a nurse midwife is we are nurses by nature, nurses by heart, and we want to take care of a patient as a whole. Like, we don't just see you as a pregnancy. We see everything about you, and we have to take care of mom in order to take care of her family. So that's kind of the beauty of being a nurse midwife, is I'm able to be a provider, but still stay true to my nurse roots and take care of a patient in all of their healthcare needs, from adolescence through late adulthood.
I think that's a very interesting job. It's so well-rounded. You're just, it's more of a holistic approach.
Very
You're taking
much
care
so.
of that whole person, whether it's still in there or on the outside. I hear the word doula. We don't have doulas here at the hospital, but could you talk a little bit about the difference between a doula and a midwife?
So midwives, we are medically trained. So we all have either master's degree in nursing, master's degree in nurse midwifery, or doctorate in nursing. So we are providers, we're nurses,
Right.
We take national certification boards. And doulas are especially trained to be your support person, to be your advocate. So they are going to come in and be your extra person. So maybe your husband or your mom or your best friend is your support person, and they're there to massage your feet and rub your back and help you get into positions, and they know you and they know what you like. But a doula is trained specifically for labor and delivery and pregnancy. So they can help you through that process and be that extra support, that extra voice, that extra cheerleader when you're feeling kind of defeated. So what's beautiful about it is doulas have that extra training to be your advocate and your support person, and then we have the medical background to take care of you and continue your plan of care.
That seems like a lot of people in the room.
It can be, but you know, it takes a village to have a baby, and it takes a village to raise kids, and so you want all those people around you that are going to support you and love you.
Oh, that's interesting. And you say there are educational classes to become a doula?
Mm-hmm. Yep.
That's, I didn't realize that.
Yeah. And then they also have postpartum doulas that can come to your house and help you with infant cares and kind of be those extra hands for you.
What part of being a midwife do you enjoy the most?
It's a hard question, but probably for me, my favorite is watching a new couple come in for their first, or a new mom in general just come in for their first visit, and they're nervous and they're so scared, and to really watch them grow and blossom and go from that fear and excitement to really stepping into themselves and having the strength and the power, and to know that she can trust her body, and then to watch them become new parents and just to be part of that process, and then to see them come back in 6 weeks and see they're doing so phenomenal, and to know that that journey has just been so incredible for them.
As you talk and I see the look on your face, I can see how much you enjoy your job.
I do.
But it makes me smile. I'm just like,
thank
oh,
you.
that's what I'm actually teary, because it's just such a sweet.
It's that, you know, a great way for me that I always tell new parents too is, you have so many people in your life that want to be in that delivery room. Like your mom wants to be there, your mother-in-law,
Yeah.
your auntie, your sister, whomever it would be. And those people are invited in because you let them in. But we're there because we want to make sure you're safe, to make sure your baby's safe, to make sure everything goes the way it's supposed to nourish and cheer you on and keep you where you need to be. But really, it's such an honor that we are invited into all these birthday parties and to be part of all these families' stories and all these families' journeys.
Wow. I'm curious about your particular practice. So if a patient is coming for their first appointment, are they able to choose which avenue they want to go, whether it be midwifery or an obstetrician?
Absolutely.
Is that possible
Absolutely.
in your practice?
And at any point throughout their pregnancy, if they say, you know what, I really like this philosophy where my midwife is going to be with me more, because the word midwife is really with women. Yeah. So, and she's going to bring me on this journey and be there for more of the process. At any point in pregnancy, from the first visit to up until the very last visit, she can say, yep, I really want this type of care for my body.
What happens if it's time for delivery and maybe you're not on call, or how does that work?
So we have 3 midwives currently, and we're getting a 4th. And so if we'll put special notes in your chart to say, yes, so-and-so would like to be a midwife patient. We've predominantly seen them. They let the nurses know on admission that they would like a midwife here for a delivery. They will call us, and between the 3 of us, and soon to be 4 of us, we will do our darndest to be there. Of course, you know, life happens. One of us might be out of town or something like that. Right, but hopefully now that our numbers are increasing, we're able to offer more and more services to women.
I know today, the focus of our show today is kind of on advanced practice professionals, which you are one of. And I'm curious about how your relationship with your physicians, how is that work?
Right.
And it seems like a huge collaboration to me.
Yep, we have to work as a team. Not just one of us is in charge, so to speak, or one of us is the all-knowing, because we all come from a different background. Well, coming from a nursing background, we're going to look at everything a little bit more holistically. We're going to be looking at the whole picture a little bit better. We're not just solely focused on the heart or the uterus or the bones. So being a nurse practitioner is such a specialty in itself,
Right.
because we all still have our heart and soul in the nursing profession. None of us will ever say we are not nurses. That will always, like, I'll speak for myself, right? That I will never not identify as a nurse. And so we really get to take care of you as a whole, but when we need more specialized, or we need to kind of zero in and really take the team approach to care, which every one of us really needs a team to take care of us at some point in our lives, whether it's a healthy pregnancy or someone who's unfortunately sick. And so by bringing in the two sides, we each are going to have a different view on what's going on with the patient and how to care for the patient. And you really can sit down and talk about it and say, well, I like this, or you like this, or what if we do this together, to come up with the right approach to each problem.
Wow. There's just so many questions I have, and we're out of time. But thank you so much for, you've been a great guest, by the way.
Thank you so much. I'm happy to be
here. And
here.
I love this topic of midwifery, and it seems to be growing in popularity, and I know it is here at Novant Health Brunswick Medical Center. So I hope you'll come back.
Absolutely.
And I really want to have you back to talk about your time in Haiti. And
oh, absolutely.
That's
my second most favorite place in the world to be.
Well, great. Well, thank you again for being here. It was great to have you.
Thank you so much.
Please welcome our next guest, Barbara Wickham, a nurse practitioner at Novant Health Family and Internal Medicine in South Brunswick. Welcome to the show today, Barbara.
Thank you. It's nice to be here.
Great to have you too. I'm excited to hear about this. Geriatric medicine is a little different than most of our practices, so I'm excited to have this conversation with you. So let's start off by learning a little bit about you. Like, where did you go to school and that kind of thing?
I grew up in Mansfield, Ohio. That's where I'm from. I graduated from The Ohio State University with my bachelor's degree in nursing, and then went on and got my master's degree at the University of Cincinnati.
Wow. Wow. Good job. So how did you get to Brunswick County?
We had vacationed down in this area for years. We finally bought a house down here, and we just decided
You finally got smart, right?
Finally got
smart.
smart.
That's what we did.
And we finally moved down here. I initially was working in the Wilmington area, and I was fortunate enough to have Novant actually take a look at my resume, and I had an interview at South Brunswick. Immediately fell in love with the practice and the employees, and I just knew that's where I needed to be.
That is a great practice. Dr. Cummings down there, she just keeps me laughing. She's
Yes, she does.
great physician.
Yes, she does.
I loved her. So I know you're an advanced nurse practitioner.
Yes.
Correct? So what does that mean? Tell me what that means.
An advanced nurse practitioner has to be a registered nurse to start with, and then goes on to get a master's degree in any of a variety of postmaster's certifications, such as women's health, pediatrics, gerontology, psychiatric nurse practitioners. So I had decided to pursue my adult nurse practitioner. And we can do essentially the same thing physicians can do. Our educations and backgrounds are different, but our goal is the same, is to take care of the patients in our practice and the public in general.
So your advanced training is in geriatrics, is that correct?
It's in adult medicine, yes.
Adult medicine.
Yes.
It's not called geriatrics anymore, is that right?
Actually, now it is called adult gero nurse practitioner. They had added the gero in because I would have to say the majority of the people we see are elderly, since the population is aging. So I found it very beneficial to get extra training in geriatrics.
So what is the difference between an advanced nurse practitioner and a physician?
Our backgrounds are generally different. A
Yeah.
physician will go through the medical training and then become specialized in whatever they would like to do. Nurse practitioners always have a registered nursing background and always come from the position of nursing. So even though our goal is the same, our training is a little different, but we essentially can do the same thing.
So your relationship with doctors, how would you describe that? Is that more of a collaboration?
It's always a collaboration, or I should say it should always be a collaboration. The physicians we work with, we can bounce ideas off of them. We can go to them and say, look, I have this issue. I don't exactly know what to do here. So they counsel us, they guide us, they make recommendations. Pretty much an integral part of our practice is collaborating with our physicians. So we're always on the same page.
And of course you can write prescriptions and write orders for any kind of testing and things like that. So they're very similar, just the training's a little different and you come from a different background.
Exactly. The training is different and they have a little a deeper I'd say like chemistry and pathophysiological background than we do.
So I'm going to say geriatric medicine again because that's what I've always known. So that specialty, what age group does that entail? What all?
Geriatric medicine, in my estimation, it's ages 50 and above.
Okay.
Definitely 60 and above. So I was presented with an interesting fact yesterday. According to brunswickcounty.org, the population in Brunswick County ages 60 and above has increased by 60% between 2010 and 2019.
That's a huge
Therefore, there is going to be a huge need for providers to be able to take care of that age range of people. They're my special people. I love the elderly population, and their needs are definitely different than a teenager's or a child's.
Yeah, and speaking of that, it must be a tough age bracket to treat because as we get older, I know myself, there are more complaints, there are more things happening, too many aches and pains. So I don't even know how you approach that. I guess it's through lots of conversations and
lots of conversation, getting to know your patient very well. So it's essentially just what you focus on is keeping them safe, trying to eliminate fall risk, making sure they understand their medications, why it's important for them to take their medications, and why testing is important at that age as well.
Yeah, I suspect some of your patients, you hear the same things. It's diabetes, it's high blood pressure, it's cholesterol, it's all sorts of, that's the typical.
Yes, exactly.
And this area seems to be a stroke belt. It seems to be a lot of strokes in this area.
Heart disease is actually the number one killer of people in North Carolina, actually. So we focus on heart disease, hypertension, stroke prevention, taking care of people who have congestive heart failure and that type of thing,
Let's talk a little bit about your education. Do you have continuing education for the advanced nurse practitioner?
Yes, we do. We have to meet a 50 CME hour or credit hour every year for the state of North Carolina. As advanced practice practitioners, we go through the American Academy of Nurse Practitioners or the ANCC, which offers us educational opportunities. And we have a minimum we need to meet for them every 5 years.
Every 5 years.
So it's constant education. It's updating your knowledge base.
Right.
It's watching out for the skills that you have, whether you like to do suturing, joint injections, and those type of things are specialty things that you really just need to keep brushed up on, otherwise you forget how to do it.
If you don't use it, you lose it.
Exactly.
Well, it's been great to have you here today. I've learned a lot about medicine in older folks like myself. And I wondered if you were accepting new patients.
I am accepting new patients. Please call the office.
That is wonderful.
Please call
and
the
we'll
office.
we'll run the phone number for the practice at the bottom of the screen. So, and they can just call and make an appointment with you
Yes.
directly. Is that
Yes.
correct? Thank you. Well, thanks so much, Barbara. It was great to have you here
It's
today.
so nice to be here. Thank you so much. I appreciate it.
You're quite welcome. Please welcome our next guest, Dr. David Koenig. And he's an internal medicine specialist here with the Novant Health Inpatient Care Specialist team. How are you, Dr.
I'm well. How
Koenig?
about yourself, June?
Thank you so much for coming today. I see you in the hall all the time. We're always running into each other, it seems like. But this is a little different, little scenario here. So most of our day today was focused on advanced practice professionals, where we've had nurse practitioners and midwives on and so forth. And so I'm interested to talk to you about how the collaboration works between you and our advanced practice professionals. But first, I want to talk a little bit about you. Tell me a little bit about your background.
So I did my training in internal medicine, which is a 3-year residency program. After completing that, I practiced in rural upper Midwest, Iowa, southern Minnesota, and did the traditional doctor thing where you rounded at the hospital, you worked in the clinic, you went to the nursing homes.
Oh my goodness, and you got home at 8 o'clock at night, right?
Some days, yes. Some days, yes. But I've been here now 13 years as
It's
a
been a while.
hospitalist, so yeah, I think it's maybe even 14. Yeah, it's going on
I
14.
think, yeah. I think,
Wow.
Yeah, I know you've been practicing here for quite some time. It seems like forever. It seems like as long as I've been here. But tell me what you do as an internal medicine provider.
So as an internal medicine provider, I purely take care of adult patients. No, technically, we're not supposed to do anybody under age 18. Sometimes there's some give and
Is there
take on
some
that.
leeway in there?
Yeah, I think it's more of a malpractice issue than it is anything.
I see.
Don't take care of babies.
Right.
We do, though, oftentimes get involved with mothers of babies that may have some blood pressure or other issues related to their pregnancy, if it's beyond what the OB doctor is comfortable with.
I see. I see. So what do you enjoy most about your job?
I think as a hospitalist, the thing I enjoy most is helping patients kind of cope with that event that leads them to come into the hospital. Obviously, if you have something going on that you need to be hospitalized for, that can be kind of terrifying, somewhat nervous, because something obviously has gone wrong, and whether that is something minor that will easily correct, or whether it's something major that may have more of a life impact on you, helping to diagnose that, deal with it, and help the patient to come to grips and come up with a ready plan to make the most out of what needs to be done moving forward is really, I find it really rewarding.
Yeah, well, you're kind of like a detective too. You have to.
Yeah, there are a lot of times when people come in and you don't know exactly what's going on, and you have to kind of sort through that. Many times, the diagnosis is already kind of sorted out in the emergency room with some of the more common things. So yeah, there's some detective work and putting things together, kind of getting to be a bit of a Sherlock Holmes, I guess, in some respects, which is always I find interesting and challenging.
I bet, and I know you're very passionate about what you do. You really take great care of your patients.
Well, thank you.
We hear stories about the great jobs that you and your colleagues do. So.
Yeah, I think we have a great team. I think everybody works well together.
Yeah,
and because we do change personnel every few days, taking care of people in the hospital, it's a pretty seamless flow so that everybody's on the same page, working towards the same outcome.
Well, as I said earlier, we're highlighting advanced practice professionals here for the next show or so. How would you best describe your relationship or the collaboration between you and the APPs here at Novant Health?
I would say it's truly a team model. The APPs and the physicians work together, be it rounding on patients, admitting patients from the emergency room into the hospital, reviewing the plan of care, reviewing medications that may or may not impact what testing should be done, how it may impact their medical problem at the time, what testing should be done. So I think it works well in an overall oversight of making the best plan possible to get the patient where they want to be.
I think you would agree that it's not, the whole show is not run by the physician. There's a whole team, a whole plethora of people involved to make the patient feel better and get to where they need to be to live a productive life. So, and the APPs would be part of that, along with radiologists and what have you. Would you agree to that?
Yeah, I think that's really been a focus, and I think one of the things Novant and our group has also done in the past few months is kind of worked on a team rounding format where we sit down for at least 15 minutes with nursing, physical therapy.
That happens every morning, right?
Correct.
You have,
yeah, so we've got nursing, physical therapy, case management,
Yeah.
all in one room, so we know that we're all talking the same language, making the same plan, and that patients then will know that if we're going this direction, that's the direction we're going, and that
Right.
not somebody saying, hey, we're going left and you're going right. And
Right.
So
Yeah. I have heard some folks say, oh, they would rather not see an APP, they would prefer to see a physician. What would your response be to somebody who said that to you in the hospital?
I would say it's probably somewhat based on the complexity of your medical problems. If you have, 5, 6, 7 different medical problems and you're taking 10, 12, 14 different medications,
more.
maybe that's correct. But I also know that there are plenty of APPs out there that are very competent, very professional, very well able to manage most medical conditions. I know at least in the Novant system, you've got again that extra layer where the APP is in a clinic with a physician and supervised by a physician. There's that collegiality where you can
Right.
ask questions of each other to make sure you feel like you have a little extra level of comfort with making the right choices for
Absolutely.
managing a medical condition.
Yeah, I like to think of it as checks and balances.
Yeah, I think
There's
that's-
always another set of eyes, a set of ears, and I never fear of seeing an APP in any of our offices because I know there's a doctor right around the corner, and you all are discussing what's best for me as a whole. So that's why I feel really comfortable with them and the way Novant Health pairs them with physicians.
Yeah, I think that's a very fair statement. And again, I think medicine has evolved
Yes.
such that so many of the parameters for goals of care are tracked not only by your physician and by the patient, but it's also tracked by your insurance company. So, whether somebody's probably going to hear about it if you're reporting to your insurance company that your blood pressure continues to be elevated, that they're going to say, well, maybe you need to get something done about that.
Right.
So,
Well, thank you so much for taking time out of your day today to be with us. It's much appreciated. And I hope I'll see you around in the halls.
oh, I'm sure you will, June.
All right. Take
June,
care.
Sorry. All right. Thank you very much.
Thank you for joining us today on HealthWatch. I hope this information was beneficial for you and your family. If you'd like more information on services provided at Novant Health, or if you're looking for a new physician, please visit our website at novanthealth.org. So be sure to join us next time right here on HealthWatch.